We all need to drink enough fluid to keep us hydrated and help us to stay healthy. As we get older, it can sometimes become more difficult to drink enough, and we are at greater risk of becoming dehydrated. How much should we be drinking every day? Recommendations are that we should all try and drink between 1.5 to 2 litres of fluid a day, which equates to around 6 to 8 drinks. Is this just water? No. Most drinks count, including tea, coffee, juice, milk, squash, as well as water. What does this look like for the person you are caring for? It could be 9 cups of tea or coffee, 7 mugs of tea or coffee, 6 half-pint glasses of water, milk or squash, or a mixture of them all. If the person you are caring for is struggling to drink enough, remember they will get extra fluid from foods that they eat, especially foods with a higher fluid content, such as jelly, ice cream, yoghurt, custard, soups, sauces, gravy, and some fruit and vegetables. Older people are more susceptible to becoming dehydrated. One reason for this is that our bodies change as we age. Our kidneys may not work as well as before. Our thirst sensation becomes reduced, and our bodies hold less water in reserve than when we are younger. The following things should be considered when supporting a person to drink well. People with swallowing difficulties or changes in swallowing may need support or referral to speech and language therapy. Can they make their own drinks? Can they hold glasses or cups comfortably? Or do they need help when drinking? Worrying about managing to get to the toilet in time or being incontinent can influence a person's decision to drink. If a person has dementia, they may forget to drink or be unable to tell someone that they are thirsty. Some medications, such as diuretics, may also put someone at greater risk of dehydration. How can you tell if someone is becoming dehydrated? Here are some of the signs and symptoms to look out for. Feeling tired or drowsy, headaches and dizziness, dry mouth, lips and tongue and sunken eyes, constipation. Blood pressure may drop, leading to dizziness, confusion, feeling sick and fainting. Changes in behaviour such as low concentration and memory problems, increased risk of falls, increased risk of urinary tract infections. Keep in mind we can't rely on just one of these symptoms to tell if someone is becoming dehydrated. You will know what someone is normally like, and if you have concerns, follow your organisation's reporting pathway so that you can get them the support they need. There are a few things that you can do when you're visiting someone's home that might help prevent a person becoming at risk of dehydration. It's important to understand why a person isn't drinking enough. Try and have a respectful conversation with them to understand any concerns they might have, such as worries about incontinence and accidents, or problems making drinks themselves. Report any concerns through the usual pathway. Find out what the person prefers to drink and when. Always make sure that drinks are easily accessible and give help to drink if needed. Be encouraging and prompt when necessary. It's easier to say, "Here's a nice cup of tea," rather than asking if they want one. Encourage family and friends to help by offering drinks while visiting. If dementia is an issue, you can try post-its and use alarms to remind people to drink. Dehydration can happen quicker than you think in older people. Being aware of the signs and symptoms and knowing what you can do can help make a big difference.